Okay, hey guys, today I'm going to be doing a presentation on triple negative breast cancer treatment. I'm sure everyone here has heard of breast cancer. Put your hands up if you've heard of breast cancer. Okay, have you heard of triple negative breast cancer? Put your hands up. See significantly less people. Okay, so I want you to think of your cancer cells like a house. With this house, you want to get inside the house and kill and destroy this cancer cell. So there are 3 locks usually on this house: estrogen, progesterone, and a protein called HER2. So with these 3 locks, doctors have these 3 keys, i.e. treatments such as chemotherapy, radiotherapy, and surgery. These keys they use on the locks in order to get inside the cancer cell house and to destroy it. However, with triple negative, these 3 locks with estrogen, progesterone, and the protein HER2, they're not there. These locks are completely gone. So the keys that the doctors would usually use, like I said, the chemotherapy and everything, is really limited for what they can actually which ones they can actually use, sorry. So in other words, triple negative breast cancer is a specific type of breast cancer that doesn't have estrogen, HER2, and progesterone receptors, making the cancer treatment methods doctors can use to target this illness very limited. The stage of the cancer describes the size and how far it's spread, whereas the grade of the cancer shows how the cancer cells look under the microscope and gives an idea of how slowly or how quickly the cancer may develop and spread throughout the body. There are 3 grades: high grade, middle grade, and low grade. Triple negative can be either of these grades, but it's usually a high grade cancer. Okay, quick quiz. Out of these 4 options, which one of these is not a symptom of triple negative breast cancer? Put your hands up for A, put your hands up for B, put your hands up for C, and put your hands up for D. Yeah, okay, you guys got it right. Okay, so as you saw just now, some symptoms of triple negative breast cancer include a new lump forming, thickening around the breast, the armpit, and the lymph nodes. They're changing the size and the shape of the breast, skin changes, and a rash or dimpling occurring. But when it comes to diagnosing triple negative breast cancer, you may undergo several treatments and tests, such as a mammogram, known as an X-ray for the breasts, and an ultrasound and a biopsy in order to take a small sample of the cells, what tissue the breast to look at under a microscope. But then again, these are all depending on the age you are, since you are more likely to have an ultrasound instead of a mammogram if you're under 35 years old. Since this is such a specific type of breast cancer, the main treatment for triple negative breast cancer is surgery, chemotherapy, and radiotherapy. But these are all again used depending on where the cancer is, the size of the cancer, and how abnormal the cells look under a microscope, and of course your general health. So when it comes to surgery, the surgeon usually takes out some of these lymph nodes under your armpit and see if they contain these cancer cells. The surgeon may check the lymph nodes closest to the breast. This is called the sentinel lymph node biopsy testing to find the stage of the cancer and decide on which further treatment to embark on next. Surgery in order to remove the cancer cells is split into 2 sectors depending on what they have to remove. If they are removing an area of the breast, it is known as breast conserving surgery, whereas if it's the whole breast, it's known as a mastectomy. Again, depending on the specific case you may have, chemotherapy may happen before or after surgery. If you have it before surgery, it is known as neoadjuvant treatment, and the aim of this treatment is to shrink a large cancer enough to make an operation possible, or it may mean that instead of needing a mastectomy previously, you can have a breast conserving surgery instead. However, usually chemotherapy happens after an operation, since chemotherapy reduces the risk of breast cancer returning. Usually you have a combination of chemotherapy drugs such as carboplatin, cisplatin, and docetaxel, and a lot of other chemotherapy drugs that I don't know how to say. Since, again, it's a really specific type of cancer, researchers are still looking into the best chemotherapy combinations, and they want to find out whether adding other drugs to improve the results of the treatment. Chemotherapy is also used during secondary breast cancer, which is when cancer has spread somewhere else in the body. Some common side effects with chemotherapy are hair loss between 2 to 4 weeks starting chemotherapy, lots of nausea and tiredness, and lymphedema and skin changes. Lymphedema is when you've had lymph nodes being removed during surgery, or if you receive radiotherapy for your lymph nodes. This is when the lymph fluid is not able to drain properly, causing it to build up under your skin, causing part of your body to swell. But alongside chemotherapy, you, as a patient, would be under bone strengthening or drugs that slow down bone thinning, also known as osteoporosis. These can help treat or reduce bone damage caused by breast cancer, and you usually have it alongside chemotherapy to prevent bone problems and reduce pain. And radiotherapy is used to treat this type of cancer and uses high energy X-rays to destroy the cancer cells by doing as little harm as possible to the normal cells around it. You can either have this after surgery and chemotherapy or before, depending again on the severity of your case and what stage of the cancer you're in. For example, if you've had breast conserving surgery, you will have a radiotherapy due to the remaining breast tissue, reducing the risk of cancer coming back in that area. However, some women who also have a mastectomy have radiotherapy to the chest, but just like chemotherapy, radiotherapy can have some serious side effects. Although these are a lot more mild, your doctor and radiographer would talk to you and the patient about how to manage these. So to conclude, triple negative breast cancer is a specific type of cancer lacking receptors for estrogen, progesterone, and the protein HER2, which limits the treatments that can be used. And the 3 treatments that TNBC patients go through are surgery, chemotherapy, and radiotherapy.